Test.
Perfect. And it's Sean
Bayer.
Bayer.
Yeah.
Okay. I think we've hit the top of the
but
hour. It's 11 o'clock.
it?
It's 11 o'clock, and all is well. I'm Heather Granato, and I'm the VP of Partnerships and Sustainability with the Informa Markets EMEA. And welcome to Vitafoods Asia. We're delighted to be back in the region for the first time since 2019, this time co-located with FI Asia, and for the first time here in Bangkok. For those of you joining us at the stage, if you're looking for the Wi-Fi, you can log in at FI Vitafoods Asia, and that's lowercase b, Bangkok 2022, and you just need to register to be able to get online. We are going to be taking questions at the end of the presentation, but for now, our next session is sponsored by TSI, myHMB, the most effective nutritional solution to increase, preserve, and support healthy muscle function. And our speaker is Sean Bayer, Vice President of Business Development with TSI Group Limited. And Sean, I'm going to turn things over to you.
Great, thank you. Thank you. I appreciate everybody's attendance today, both here in the audience as well as online. Today we're going to talk about the ingredient HMB, healthy muscles, healthy lives, the role of HMB in human nutrition. Now, one thing we want to talk about when we start looking at HMB and the role it plays in nutrition is our muscle health in general. In our market, we all hear things about joint health, cognitive health, cardiovascular health, but we've really overlooked a very key body system in muscle. And muscle health is something that we feel is an overlooked category. It creates a great opportunity for the consumer segment of not only what you typically think about with muscle health would be the bodybuilders or the fitness enthusiasts, but also those that are looking for a benefit to the active or body comp, as well as the consumer group about healthy aging. Because as you can see in our illustration here, we have a muscle reserve that is built during growth and maturation. It reaches a pinnacle, and then unfortunately, after about the age of 30 or 35 years of age, we see a gradual but very consistent loss in muscle mass, as much as 10 to 15% per decade. That's 1.5% per year. And that's almost the inverse of what we think about when we look at the finance world of compounding interest. It's the same problem, but in reverse here. Here we're talking about a diminishing return every single year of that loss in muscle mass. So that directly impacts our quality of life. So you look at all these amazing ingredients we have and the foods we've done in the advances in healthcare to live longer and improve longevity, but what are we doing about quality of life? Those years later on, as you can see in the high-risk zone, if we don't have muscle reserve, if we fall on that more aggressive trajectory, we don't have muscle to maintain the quality of life we're used to. But with simple interventions, nutritional interventions as well as exercise, we can maintain and build that reserve and that capacity at a very early age and maintain it throughout as we age. There'll still be a loss, but we want to optimize that reserve. And most importantly, during times of recovery from illness or injury or disease, we have situations where we see a hyper loss in muscle mass or atrophy, like cancer cachexia, age-related sarcopenia. And if we can offset that loss and maintain that muscle mass, we have a much better outlook in our later years and quality of life. So let's talk about the ingredient HMB. So we know HMB is a downstream metabolite of leucine. It stands for beta-hydroxy beta-methylbutyrate. And it's been well established in the fitness and sport world, and it's also been well established in the more of the clinical nutrition. But as you'll see here, there's two very exciting areas that we feel has the greatest potential for the consumer markets that we deal with here in the nutritional industry. HMB uniquely both stimulates protein synthesis, or the building of muscle, while it reduces the protein breakdown side, or in other words, the degradation of muscle. If we can create this small nutritional shift between balance between loss and between gain, we have a greater balance or increase in mass. So the first category I want to talk to you about today is about active nutrition and body composition. We were very fortunate for Nutri-Ingredients Asia Award in 2020. We were a finalist for the Innovations in Women's Health Award, and it had to do with an intermittent fasting study. So there's currently a trend in what we consider a regimen for diet or calorie restriction, and that's intermittent fasting or time-restricted feeding. That's where we try and take our full day calories and we limit it between in essence, one long period of fasting between fasting and feeding. So if we have 16 hours of fasting, 8 hours of feeding, we find that that is a very effective strategy to lose fat with very little adjustment in the total caloric change. It's just merely a timing of when those calories are ingested. Now, one thing we know about the loss in weight during those time periods is unfortunately we see a loss in muscle, not just the fat component we want to lose. So if we can somehow offset that loss of muscle while we're trying to lose fat, the net gain again will be greater and we keep that metabolic engine intact. So in this study, the main area I want to point to you is if you look at the changes over an 8-week study. This was a normal eating schedule, so they just followed a traditional diet where they ate between 8 a.m. and 8 p.m. And then they received a placebo. The other two groups were the time-restricted feeding. So the feeding period was between noon and 8 p.m. with the placebo, and then noon and 8 p.m. with HMB supplementation. And during that time period, what was amazing is that not only did the HMB help maintain muscle, as you see in that third group, the fat-free mass, but it also had a greater reduction in fat mass. So we preserve the muscle while we lose the fat. Therefore, we see a net change in weight, but we more importantly see a bigger change in body composition. And that ultimately is what we want to go for. Well, just looking at the scale is not, even though that's what the consumer's been trained to do, it's not what's the appropriate approach for long-term success in weight loss. We want to lose fat, maintain muscle. There we go. So as I mentioned before, in muscles, we see with HMB supplementation, we see an increase in protein synthesis and a reduction in protein breakdown. But in fat cells, we also see an increase in fatty acid release or fat breakdown. Coincidentally, we also see an increase in fatty acid oxidation in muscle cells. So what happens is we get this almost like crosstalk. As we're maintaining muscle, we release free fatty acids out of our fat stores, which go into the muscle through beta oxidation. We see an increase in caloric expenditure from that stored fat. These are just two quick little slides here just to show you the mechanisms. We see on the left side here, we see an increase in fatty acid breakdown from the fat cells or lipolysis. And in the right side, we see the oxidative metabolism, beta oxidation that occurs in the muscle cell. So these two show that the shift is because of the plasma concentrations, or in this case, the cell culture medium concentrations of HMB. And again, this just reiterates that increase in muscle beta oxidation with increases in HMB in the cellular medium. This is just a quick overview of what I just basically went over. So we see with HMB supplementation, on the right-hand side here with adipose tissue, we see an increase in lipolysis, which releases fatty acids into the bloodstream. And then in the muscle, we see an increase in beta oxidation, or that utilization of that freed up fat store. So all in all, what the outcome is we see a maintenance of muscle while we preferentially lose fat in that weight loss scenario. So let's move quickly here into the healthy aging aspect of how HMB can benefit the consumer. Again, very proud of the relationship we have with Nutri-Ingredients, and winning this in 2021, we were the ingredient of the year for healthy aging. Again, it's that recognition that we look at muscle health as a health category. And this really came from research that we had done in the United States through the National Institute of Health. It was a year-long study looking at the combination of HMB and vitamin D to maintain muscle. What is amazing about the research that led up to this is that we had seen over time in several different studies that when you combine HMB with key amino acids, or in other words, those building blocks from protein, when you combine those with HMB, we saw an increase in things like knee extensor force, the get up and go test. A get up and go test, for those that don't know, if I were to set a chair on this side of the stage, 3 meters, I get up, I walk, I touch the 3 meter mark, return back. For all of us, it's very easy. But when we get into our 70s, 80s, and 90s, that test is a true measure of our ability to actually have that quality of life or that free living accessibility. So with that, we observed an improvement in the get up and go test, which was very significant. If you look at the placebo group here it was a 12-week study here. These individuals received HMB with some amino acids or a placebo. It was an isochloric placebo. But what was really intriguing about this is that you'll notice in the placebo group, over 12 weeks, there was really no change in that get up and go performance. know that we're only in probably 15, 16% of the older adult population follows some type of exercise program. Not necessarily because they don't want to. Many a times they don't have the ability to do it because they don't have that basic strength or function. So if we can create a product that's an intervention for these older adults to have this additional benefit and get stronger and have more function and have more strength, maybe they can start that exercise program and build that reserve that we talked about in the very first slide. That muscle reserve is critically important, and just a little bit of a push towards a greater reserve is going to have outcomes in longevity and quality of life for years and years to come for that individual, that consumer. And with that, I say thank you. If there's any questions, I'm happy to address them here on the floor or at our booth.
All right, thank you.
Thank you.
Okay, I got my get up and go.
Fantastic.
That's right. Do we have any questions from the audience? Anyone? Here's one over here.
Thank you for your presentation. I just wanted to say, I'm Dr. Jayanta from India. I just wanted to know, sarcopenia is a problem with the aged. However, there are lots of patients who suffer from muscle weaknesses. Maybe after a trauma, a fracture, or maybe some other injuries, they suffer from weaknesses. And there is a common cerebrovascular accident which leads to stroke, where the muscle weakness happens not only in the affected side, also on the unused opposite side, because the patient is forced to stay on the bed. Now, what do you, think that myHMB would be able to contribute to their well-being on these patients?
Yes, and I truly appreciate that question, because as I led off, we have several consumer groups we focus on with HMB right now. One of them is the clinical nutrition. I only highlighted the muscle health categories of aging and the body composition change because of our recent Nutri-Ingredient Awards. But we've done a tremendous amount of research with HMB in products for cancer cachexia, AIDS wasting, bed rest studies, as well as post-orthopedic repair studies. HMB has been shown